And to begin with, the IPC sections. Okay. IPC sections, some are very, very important, like dowry death. Okay. Dowry death section you should remember. And inquest, because we are closely related to inquest. We see the inquest and we do the postmortem again. So sections related to inquest. And wound certificate, we issue the wound certificate. So all the IPC sections closely related to wound certificate. Okay. And some other here and there, some other relevant sections will be there, which are very, very important. Okay. Perjury. Perjury means giving willful false evidence under oath. Okay. Well, the example of perjury is a doctor going to give a witness in the court or an evidence as an expert in the court under the oath. You are taking an oath and then giving the evidence, and you are giving willfully some wrong information to the court, and which results in the conviction of the accused or release of the acquittal of the accused. Okay. So that is a perjury. A witness while under the oath, the witness is liable to be prosecuted for perjury. So whoever, if later on the court comes to know that it is a case of perjury, the doctor has given a false evidence under oath, the doctor is liable for punishment. Okay. So they are asking under which section where the imprisonment may extend to 7 years, which it falls under which section. Okay. So this is purely, you have to mug up and remember, there is no other technique than that. Okay. So is it 190, 92, 93 or 91? Okay. So it is under the section 193 IPC. Whoever gives, not only the expert evidence, even the common witness, okay, a layman also, if he is giving a false evidence under the oath, then he is liable for punishment under the perjury section. Okay. So it is 193 Indian Penal Code. So 191 or 192 are also important for us to remember, because 191 is giving false evidence. Okay. It is a definition of perjury. Perjury is defined by 191, and 192 is fabricating false evidence, okay, creating a false evidence. For example, you want or somebody wants to blame some person for robbery. Okay. So you are going to keep something in his bag. Okay. You are fabricating a false evidence. When on inspection, if that particular lost thing is found in his bag, then he will be blamed as a thief. So that is a creating or fabricating false evidence. So whoever states a false statement in the court under oath, or whoever creates a false evidence, this specific fabricating false evidence is in relation to police officers. Sometimes the police officers, they create a false evidence so that a person gets acquittal or conviction. Okay. So that creation of false evidence or giving a false statement in the court is defined under 191 and 192. And the punishment for that is defined under 193. So repeatedly, this is a very repeatedly, commonly repeated question, because we are closely related. As a doctor, we go several times to the court to give the evidence. So we have to keep in mind about the definition of perjury, which comes under 191. Fabricating false evidence, for example, if there is no alcohol in the stomach contents. For example, a doctor has poured some alcohol into the stomach content and send it for analysis. Later on, the FSL will find the alcohol in the stomach contents. That is also fabricating a false evidence. That comes under 192, and the punishment is under 193. A woman died within 5 years of marriage. Okay. After 5 years of marriage, she has died under suspicious circumstances. So it is not a natural death; it is a unnatural death. Her parents complained that her in-laws used to frequently demand for dowry. Under which of the following sections can a magistrate authorize autopsy of the case? Okay. Is it 174, 176, 304 or 302? Okay. 302 and 304 you can never forget. Okay. 302 and 304. 302 is punishment for murder. 300 is definition of murder. 302 is punishment for murder. 304 is culpable homicide not amounting to murder. Okay. There is no intention on the part of the person who is doing that act. That is called as culpable homicide not amounting to murder. There is no pre-planning in culpable homicide not amounting to murder. Generally, the examples for culpable homicide not amounting to murder are the road traffic accidents. Okay. The road traffic accidents, there is no intention on the person to to kill that particular person. It has happened accidentally, but it is a homicide. Homicide is nothing but killing other person. He has killed that other person, but it is not a grave crime as that of a murder. Okay, so culpable homicide not amounting to murder. There is no intention on the person who is committing the offence. That is 304. Again, under 304 you have two sections, 304A and 304B. 304A is closely related to doctors. It is rash and negligent act. Okay, it can be also road traffic accident, driving a car rash and negligently, or doing a surgery rash and negligently without proper care. That is 304A. 304B is dowry death. Okay. So here the question they are asking is, under which of the following sections can a magistrate authorize the autopsy? One basic thing you have to remember is, the above two options are CRPC, the below two options are IPC. The difference between CRPC and IPC is, IPC defines crimes, okay, and gives punishments for that crimes. Under IPC, Indian Penal Code, they define what is dowry death, they define what is rash and negligent act, they define what is murder, and they also give punishment for dowry death, they also give punishment for rape, they also give punishment for murder. That is IPC. CRPC is Criminal Procedure Code. When a offence occurs, how the authorities should proceed, it is like a book telling them what should they do when there is a dowry death, who should conduct the inquest, and who is authorized to order autopsy, and what is the procedure of investigation. So, criminal procedure. So, here they are asking, under which of the following sections can a magistrate authorize. So, that is a procedure. It is not a crime or it is not a punishment. It is just a procedure. So, you should clearly rule out the below two options. IPC, it does not come under the procedures. Okay. So, only it can be 174 or 176. 174 and 176 are both very, very important. 174 is police inquest, 176 is magistrate inquest. Okay. So, 174 police inquest is all done in all types of crimes. Okay. Like any type of incident happening, immediately the police station will receive the crime, and the police officer should intimate the nearest executive magistrate and rush to the scene of offence and conduct a panchanama there, which is otherwise called as a inquest. Okay. Police inquest, it comes under 174. But there are some exceptions where the police cannot do the inquest. Okay. Only the magistrate is authorized to do the inquest. For example, if the police are the offenders, okay, if the offence has happened in presence of police, or the accused is a police officer, a death happening in a jail, the police cannot do the inquest because there will be bias. Okay. To prevent that bias, the magistrate will do the inquest. One example is death occurring in a prison, death occurring in a police custody, death occurring during police firing, and death occurring in a psychiatric hospital, dowry death, exhumation. All these things are where the magistrate is authorized to conduct the panchanama or the inquest. There the police have no role, and the magistrate will, after doing the panchanama, if he feels that there is something to know about the cause of death, he will order the autopsy. If he does not feel that there is a need for autopsy, he will hand over the body to the relatives for the further procedures. Okay. So, 174 CRPC is police inquest. In all the cases, police are authorized to conduct inquest, but there are exceptions, like when the police are offenders or the person is dying in a psychiatric hospital, when it is a dowry death, when it is a exhumation, only magistrate is authorized. So, what is a dowry death? When do you call it as a dowry death? Within 7 years of marriage, if the woman dies, then it is called as a dowry death, and that death should be under suspicious conditions. It should not be a natural death. If it is a natural death, then there is no scope to call it as a dowry death. For example, a woman dying because of complications of a pregnancy, you cannot call it as a dowry death because she has died within 7 years of marriage. Okay. So, it should be an unnatural suspicious death which is occurring within 7 years of marriage. So, here the option is 176 CRPC. So, a person X hits another person Y with a wooden stick on provocation. Okay. So, here the clue is the provocation. Suddenly, two people are talking and that other person insults or states a statement that initiates provocation in the opposite person and he picks up that the neighboring article and hits that other person, there is no pre-planning. He has not come with a wooden stick to that person with a pre-planned, premeditated action. Okay? He is doing it instantly on provocation. This leads to the formation of a bruise or contusion 3 by 3 centimeters on the forearm. No other injuries are noted. Which of the following is true regarding his punishment? Okay. So, imprisonment for 1 year and fine of ₹1,000, imprisonment for 2 years and fine of ₹5,000, imprisonment for 1 month and fine of ₹500, or rigorous imprisonment for 6 months. The clues here are, it is just on provocation and it is a very minor injury which is a bruise, and it is on a hidden part, it is on a forearm, it is not on an exposed part also. Okay. So, rigorous imprisonment for 6 months is straight away you can rule out. For such a small injury where there is no intention on the person, and the injury also is a self-limiting injury, it heals on itself, there is no treatment required, and it is not an open injury or it is not causing a deformation. So, rigorous imprisonment is not the punishment for that particular. And imprisonment for 2 years also you can straight away rule out. Either it can be 1 year with a fine of ₹1,000, or it can be imprisonment for 1 month for 500. So, based upon that you have to come to a conclusion regarding it is a very simple injury, it is not a grievous injury. So, 2 years and 6 months of rigorous imprisonment straight away you can take them out. Okay. So, the actual option is, it falls under section 334, where voluntarily causing hurt on provocation. So, again there is a difference between hurt, grievous hurt and simple injury. Hurt is something, a bodily injury or a infirmity or a disease which is caused by the other person. It is almost like a simple injury. You can call hurt and simple injury similarly. Okay. Hurt comes under section 319. Section 319 is also very, very important to remember. Immediately adjacent to that is section 320. Section 320 is grievous injury. Okay. Grievous injury, there are 8 components are there, like permanent loss of vision, permanent loss of hearing, and impairment. Emasculation is the first one you have to remember, emasculation, and then comes the vision, then comes the hearing, then comes the loss of part, or sometimes the part will be there. For example, there will be a complete amputation below the knee. Okay. Sometimes the leg will be there, but because of some nerve damage or muscle damage, you will not be able to use that leg. Okay. So, inability to use that part, he is not in a position to use that part, or a fracture or dislocation of tooth, or any disfiguration of the face, or a bodily injury which endangers the life, okay, where there is a risk of life. For example, with a rod, if a person hits on the leg, and with the same rod if he hits on the head, which is endangering the life, the injury which is on the head. So, there is a risk for life when he hits on the head when compared with the leg. So, when it is endangering life, it comes under grievous injury. Similarly, severe bodily pain, whenever the patient complains of severe bodily pain, it also comes under the grievous injury. And any injury which restricts the individual to perform his day-to-day duties for a period of not less than 20 days, okay, it is considered as a grievous injury. Why they have come to an opinion to give it as a 20 days, why not 15 days or 10 days? Why only 20 days? Why didn't they take 10 days or 15 days or 30 days? Because the salary is calculated in the first 20 days. Generally in the offices, they calculate the salary on the 20th. After 20th, they will take the attendance till that, and then they will calculate the salary. Okay. So, based upon that, they have taken that not less than 20 days. Okay. So, if more than 20 days, then it is considered as a up to a period of 20 days, it is considered as a grievous injury. So, all these 8 components, they are absent is this particular thing. It is a very simple injury. It is 3 by 3 centimeters contusion which is heals without producing any disfiguration, and it is also present on a hidden area. Okay. So, voluntarily causing hurt, there is a punishment for hurt also. Okay. Punishment for hurt, on premeditation, okay, on with planning, but here it is just on provocation. There is no intention on the part of the individual. Okay. So it extends up to 1 month with fine which may extend to 500 rupees. Okay. So the option C is the correct one, the best one or the apt one. Identity of rape victim is protected under which of the following sections of IPC? So sexual offence, previously there used to be very many number of questions coming from sexual offence, but there is a lot of change in the sexual offence after the Nirbhaya Act. Okay. So very less questions will be there, and one of the most important question related to rape is the age of consent for sexual offence. Previously it was 16 years, now it has been increased to 18 years. So that is one major area where the change has occurred in the sexual offence. Age of consent for sexual intercourse has been increased from 16 to 18, and statutory rape also automatically increases. Statutory rape is nothing but it is related to the consent. Previously it was 16 years, now it again comes to 18 years. And previously the penetration of the organ was important. Okay, penetration of the organ was important and ejaculation was not important. Now they have included all other terms like not only the penetration of penis, any other object or manipulation. Okay, even seeing or showing any actions of offensive nature, in offensive nature is also considered as sexual offence. So you will not get any questions related to that. The only one major question will be the age. Okay, it has been increased from 16 to 18. So the identity of the rape victim should be confidential. They should not reveal that both the doctor and the media, they should keep the identity of the rape victim confidential. They should not reveal it to anybody. So it comes under section 228A. All other sections are not so important for you except the 228A. 228A is where the identity of the victim should be kept confidential. Penalty awarded according to the Dewry Prohibition Act. Okay. So there will be a confusion between dowry death and Dewry Prohibition Act. Dowry definition and dowry death are different when compared with the Dewry Prohibition Act. There is an act which prohibits the both giving and taking, where the person who is giving the dowry also is punishable, as well as the person who is taking the dowry is also punishable under this particular act. So it is 15,000 rupees and 5 years. Okay. So you should not get confused with the dowry death punishment. Dowry death punishment is 7 years. 7 years of imprisonment, and it should be within 7 years of married life, and it should be unnatural, and there should be an evidence of cruelty in the recent past of the death. Okay. And it is not less than 10 years, and sometimes depending upon the circumstances it can be extended to life imprisonment. So there is a difference between Dowry Prohibition Act and dowry death. In Dowry Prohibition Act there is only giving and taking of the dowry. Both the father and the father-in-law are accepting the dowry. Okay. From some other person, some third party is giving information regarding the exchange of dowry between them. Okay. So that they are punishable. Both of them are punishable under the act. So it is 50,000 rupees and 5 years. 498A is another important thing when in relation to the dowry death. Here there is no death. Okay. In 498A there will not be any death, but there will be cruelty. There will be torture, there will be mental harassment, there will be physical harassment, and the punishment is 3 years plus fine. Okay. And 113A and 113B Indian Evidence Act is, according to this act, it is automatically presumed, okay, that it is a case of dowry death. Whenever the death in an unnatural fashion occurs, it is presumed that it is a dowry death. Okay. And because of that, the magistrate is doing the inquest. Okay. And whenever a dowry death is happening, 2 doctors should be present to do the autopsy. The postmortem examination should be done by 2 doctors. So these are all the important points regarding the dowry death. One is it comes under 304B. When do you call it as a dowry death? It should be unnatural death, and there should be an evidence of cruelty or harassment towards that girl, and it should occur within 7 years of marriage, and the punishment for that is not less than 10 years, or it may extend to life imprisonment. And 498 is just cruelty. There is no death in 498A. Okay, only cruelty, and then the girl will state that there is a harassment for dowry from the in-laws. Okay, and here the punishment is 3 years together with fine, and according to section 113A and 113B. Here you can clearly see they are Indian Evidence Act. So there are 3 types of acts: Indian Penal Code IPC, which defines crimes and defines punishments. CRPC is procedures. Indian Evidence Act is the evidences. Okay, so here it is automatically the evidence, it is on the death, they presume that it is a dowry death. Okay. So Dowry Prohibition Act, there is a penalty for giving or taking dowry, imprisonment for a term which shall not less than 5 years, and with fine which shall not be less than 15,000 rupees, or the amount of the value of such dowry, whichever is more. Okay. Penalty for demanding dowry. Okay. Here there is a transaction in the first thing. In here they are demanding, so it will not less than 6 months, but which may extend to 2 years, and with fine which may extend to 10,000 rupees. Okay. Hurt is defined under which section? 320 is grievous hurt. 321 is related to hurt again, voluntarily causing hurt. 323, before grievous hurt comes the hurt. Okay, before grievous injury comes the normal simple injury. So it is 320 is grievous injury, before that comes the simple injury. So it is 319 IPC. Okay. So 323 IPC is punishment for voluntarily causing hurt. Okay. So it's not that important, but 320 and 319 are very, very important sections. 319 is almost like a simple injury. There is no mental agony in case of 319. Okay, in the case of hurt. (197) is related to causing disappearance of evidence, issuing false certificate by doctor, giving false evidence, examination of accused. Already from the previous questions you can clearly say one of the option, giving false evidence. Giving false evidence comes under 191. 191 is giving false evidence. 192 is fabricating false evidence. 193 is punishment for giving or fabricating false evidence. Okay. So giving false evidence, C is ruled out. Okay. Causing disappearance of evidence. Okay. There is a disappearance of evidence as well as examination of accused. So it is issuing of false certificate. It is very, very important again for the doctors. Many doctors, without seeing the patient, when somebody comes, they give a illness certificate or sickness certificate for job purpose or for education purpose, for something. So it is a crime and it is punishable. When the authorities find out, it is a physically handicapped certificate, okay, sickness certificate, wound certificate, all types of certificate. Whenever somebody issues a false certificate, it comes under IPC 197. So there are some important sections in relation to medico-legal work. Okay, one is 39 CRPC. 39 CRPC is a procedure again. So whenever a suspicious case of accidental homicide or suicide comes to a government hospital, the doctor is bound to inform the police. It comes under section 39 CRPC. Okay. A private doctor is exempted from intimating about the suicides. Now they have removed the attempt to suicide also from the punishment. Okay. From 309 they have completely abolished the section 309 IPC, which defines attempt to suicide. For example, a person has climbed a cell tower, okay, and he threatens somebody to fall from there. It is an attempt to suicide. He will be catched and he will be prosecuted. There is a procedure by which he can be prosecuted. But now they have abolished that, because the person is attempting suicide because there is some mental derangement is there, because of some psychiatric illness, he is going to a normal person will not attempt a suicide. Only whenever there is a mental abnormality is there, that's it. So punishing or whenever a crime is committed by a person of unsound mind, it is not a crime, okay, because there is according to McNaughton's rule, whenever a crime is committed by an unsound mind, it is not a crime. So they have taken into consideration that, and they have removed the attempt to suicide, and they are only providing the psychiatric treatment or psychiatric counseling depending upon the mental status of the individual. They are providing the counseling to that particular person who has attempted suicide. So attempt to suicide or suicide is removed from the private practitioner's area, okay. Only the cases of accident and homicide should be intimated by the private practitioner, okay. A government practitioner should inform all the cases irrespective of the nature, whether it is a homicide, suicide or accident, okay. So 39 CRPC is intimating a medico legal case to the police, and when a doctor doesn't intimate a case to the police, he is punishable under 176 IPC, okay. And 175 CRPC is giving information on summoning. So first when you give information, later on the case will come to the court, and at that time the court will send a summon to the doctor to come and give evidence in the court. That is 175 CRPC. When the court summons, you have to provide all the documents to the court. You have to give every information to the court. When you conceal an information, then again the doctor is punishable under 202 IPC, okay. And 193 is, all of you know, it is perjury, giving a false evidence or punishment for perjury. Either it may be a false evidence or fabricating evidence, okay. So these are the importances. 39 CRPC is government doctor should inform all three types of cases: homicide, suicide and accident. Private practitioner is exempted from suicide, okay. And 176 IPC is punishment if there is no intimation, okay. And 175 CRPC is giving information when summoned, and when it is not followed or whenever there is concealing of information is punishable under 202 IPC, okay. Death caused by medical negligence is under which section, which IPC? 304A. No one will forget that 304A, Rash and Negligent Act, okay. 304 is culpable homicide not amounting to murder, and then under it there are 304A and 304B. One is 304A where it is rash and negligent death, and 304B is dowry death. 351 is assault. Assault is nothing but threatening another person, okay. So that I will hit you, okay, that is called as assault. And 312 is again causing miscarriage. 312 to 315 are again important because they are related to abortion, okay. They are related to criminal abortion, okay, miscarriage. So now you know 300 is murder, 302 is punishment for murder, okay. 304 is culpable homicide not amounting to murder. 304A is rash and negligent death. 304B is dowry death, okay. And 312 to 315 are abortion, related to abortion. 319 is hurt. 320 is grievous hurt, okay. 300 is definition of murder. 302 is punishment for murder. Miscarriage is under which IPC section, okay. Miscarriage, okay. Is it 320? 320 all of us know it is grievous hurt, okay. 312 to 315 all are related to abortion, but there is a slight difference between them. We will see what is that, okay. So it is 312, okay. Miscarriage is defined under 312. Any person or the woman herself inducing abortion is considered as an offence under 312. When it is done not under the indications, when it is done judiciously, then it is medical termination of pregnancy. If it is done without an indication, okay, then it comes under the 312 IPC. When death of such a woman occurs, then again it is defined as a crime, and then a separate punishment is given, okay. Whenever an abortion is being conducted and the woman dies because of the procedure, then it falls under 314 IPC. Okay. And 315 is generally abortion is considered before viability, okay, before 7th month. Okay. After 7th month also, whenever the after 7th month it is viable and it is almost considered as a child from the 7th month. Okay. So, whenever somebody prevents the child to be born, okay, at the time of labor, especially at the time of the labor, when they strangulate the child or when they do not provide by acts of commission or by acts of omission. For example, act of commission is strangulating the child with the umbilical cord and saying that there was a cord around neck during the delivery and the child has died. Act of omission is not ligating the cord. You have separated the cord, but you are not ligating, you are not preventing the loss of blood. Okay. So, that is omission. You are omitting something or committing something and then causing the death of the child, or immediately after the birth of the child you are killing that particular child. Okay. So, that comes under 315. Okay. So, after viability generally it is 315, before viability the other sections. Okay. 312 defines the miscarriage, 314 is whenever the death occurs of that particular woman. Okay. Under which section police can arrest a person and ask medical officer to examine him without victim's consent? Okay. Without the victim's consent, for example, a person has been arrested in a sexual offence case. Okay. The police will arrest him and ask the medical officer to examine him. Are you bound to take consent from that? In each and every case of examination, you have to take the consent of the patient. But when the patient is an accused in some crime, are you going to take the consent or not? Are you going to take the consent or not? You are going to take the consent. You are bound to take the consent. Okay. But if the accused rejects consent, he does not give you the consent, are you going to stop the examination? No. So, it is according to the section 53 IPC. Okay. So, according to section 53 IPC, actually it should be IPC or something else. It is a procedure or it is a procedure. The option should be 53 CRPC. So, it is 53 CRPC. They have wrongly typed it as IPC. Okay. So, it is a procedure where you are bypassing the consent because the patient is a accused. You are examining the patient without his consent, because the sexual offender will try to avoid the collection of evidence from him for his conviction. Okay. So, he will say that he will definitely not give consent. Okay. So, you are not going to stop there, and you are going to examine him with the permission of the investigating officer or the police officer who is accompanying you. You will take the consent of that police officer. Okay. And then you conduct the examination. So, it falls under section 53 CRPC. Section 53, again IPC they have written it, it is CRPC is kidnapping. An accused can be examined by a medical practitioner at request of police even without his consent or by force. Okay. So, perjury is (191) and 192 are definitions and 193 is the punishment. Okay. Section 312 to 315 deal with voluntary miscarriage. Okay. Kidnapping and abduction are 360 to 369. Okay, 362, they are not so important, do not remember. If you remember too much of information, then you will not be able to remember anything. Okay. It is not important. Attention and abetment to suicide is also, forget about it because it has been removed. Okay. Abetment has not been removed. What is the difference between attempt and abetment? The first one is not attention, it is attempt. It should be actually attempt. Attempt has been removed because the person is attempting because of some psychiatric illness. Abetment is encouraging someone, that has not been removed. That is again under 305 and 306. 305 is abetment, encouraging a child to commit suicide. 306 is adult. Okay? 305 and 306. Why they have not removed is sometimes in dowry death, the woman will commit suicide because of the harassment of the in-laws. Okay, so that is the reason. So the person encouraging the suicide is of a normal sound mind. He is causing some problem to that person, and that person is committing suicide, and there is death. So that person will be prosecuted, who is abetting or who is encouraging that person to commit the suicide. A leader giving a provocative speech, and hearing on that speech somebody commits a suicide, then the leader will be booked under abetment of suicide, encouragement of suicide. Okay. Grievous hurt, 320, all of you know 320. Okay, it is voluntary. So suicide, remember 306. 305 also very rarely asked. 305 is nothing but abetment of a child for suicide. 306 is adult. (320) grievous hurt. Okay, defines hurt immediately before that. 319 attempt to murder. 307 attempt to murder is 307. Murder, in murder there is a death of the individual. In attempt to murder there need not be a death, but there will be a injury which is endangering the life of the individual. And 302 300 defines the murder. Okay, according to which section a person can be punished for murder with imprisonment for 10 years. Okay. Is it 301, 300, 302, 304? 301 is nothing but it is a different type of murder which is committed by a life the person who has been given life imprisonment, he commits a murder, that is 301. Okay. So his life imprisonment will be converted into death penalty. 301. 300 is definition of murder. 304 is definition of culpable homicide not amounting to murder, and the punishment is also included in that. And 302 is punishment for murder. It is 302. Okay. For 304, you may be getting confused because the 304 is culpable homicide not amounting to murder, but the punishment is not so severe, not 10 years. It will be very limited, 2 years, depending upon the circumstances, whether there is rash and negligent act or whether there is negligence on the part of the offender. Okay. Sodomy comes under which section of IPC? Okay, it is 375 is another important, very important section. 375 is definition of rape. Definition of rape is 375. Punishment for rape is 376. And unnatural sexual offence comes under 377. Okay. 354 is outraging. They are not so important. Don't remember them. Outraging the modesty of a woman, or 378 theft. Don't remember them. The two important sections here are 375 and 377. 375 is 76, 77. 75 is definition of rape. 76 is punishment for rape. 77 is unnatural sexual offence. So what are the unnatural sexual offences? Sodomy, masturbation and anyone who is online, what are the unnatural offences, sexual offences? Bestiality and sodomy, and masturbation is also sometimes, masturbation is not an offence. Okay. Lesbianism is a perversion. Okay. To an extent it can also come under unnatural offences. Okay. Quantum of punishment in dowry death, already I have shown you. 7, 5, death, and 10. There is no death punishment for dowry death, okay, it is 10 years. Already we have seen it under the 304B. Okay. Miscarriage due to negligence of doctor is seen under which IPS section? Miscarriage occurring due to negligence of doctor is seen under which IPC section? 310, 311, 312, 314. It is 312. Okay. Any person who is causing miscarriage. Okay. Voluntary miscarriage. There will be a consent of the woman. Without consent also it can occur. Without the consent. For example, a doctor is performing some other procedure on the woman who is already pregnant, and or for example, if the doctor doesn't know that the woman is pregnant and he prescribes some X-ray exposure to X-rays, or giving a teratogenic drug, or doing something, because of that there is an abortion or miscarriage. Okay, so it falls under, any miscarriage falls under 312. 320 is grievous injury. Attempt to murder is 307. 300 is defines murder. Hurt is 319. Dowry death is under which IPC? 304A is rash and negligent. 304B is dowry. There is no 305A and 305B. It is only 305, which is abetment of suicide in case of a child. According to section 82 IPC, a child's act is not considered as a crime if he is very good, less than 7 years. So, criminal responsibility of age is very important when a child is considered or liable for his actions. Okay? Less than 7 years, any action committed by a child is not an offence. But there is an exception. According to Indian Railway Act, it is less than 5 years, it is not considered as a crime. But between 5 to 7 years in the Railways Act, for example, if a child between 5 to 7 years throws a stone onto a railway compartment and it causes some damage to that railway compartment, it is considered as an offence between 5 to 7. Okay? But according to the general law, it is not an offence below 7 years. 7 to 12, 83 IPC. 83 IPC, it is considered as it is considered as a crime, but the prosecution or the defense lawyer should state that the child is not having the mental maturity to understand the consequences of his actions. Okay? He has done an action and it has resulted in some damage, but that particular child is not having so much of mental maturity that such an action will result in such a damage. Okay? So, they will prove that and they will acquit the child. Okay? If it is proved that the child has done the damage and child is having the mental maturity, what is the consequence? How they will be punished? You will be sent to you will not be sent to a Boston school. Depending upon the offence, if it is a very less serious offence, then the proper counselling will be given to the child and a bond from the parents will be taken that the child will not repeat the offence again. Generally between 12 to 18 years, where the child is when it is considered as juvenile. Okay? In those cases, when it is proved that he has done the offence, he will be sent to the Boston school or the reformatory school. Okay? And in capital punishment is never given for a juvenile. A death penalty is never given for a juvenile. And whatever punishment they give, he will be released at the age of majority. For example, at 12 years he has committed a crime and the judge has ordered 10 years imprisonment. He will come out at 18 years only, because 12 to 18 it is 6 years only, but after he becomes major he will be released. He will not serve the entire 10 years of his life. What is life imprisonment? How long is life imprisonment? Life imprisonment is nothing but till his death. There is nothing, no rule like it will be released after 14. Only in movies you see that after 14 years he will be released. Life imprisonment means till the death of the individual. All sections of IPC are related to grievous hurt except 320 is grievous hurt. 331, 326 are a different type of voluntarily causing grievous hurt or grievous hurt on provocation, all those things. Okay. 390 is only hurt. Okay. That is the simple thing by which you can rule out. Okay. They are asking only about which one among the following is not grievous hurt. You definitely know that 319 is hurt. Okay. 331 is a grievous hurt caused to extract confession. A person will be picked up by the police, he will be taken to the jail or the prison or the police station, and he will be given third degree. That third degree will cause some injuries. Okay. That the intention for the police to cause grievous injury in that particular person is to extract a confession. Okay. They want him to confess something. Okay. So when it is done for that, then it falls under 331. Okay. That is also not important. Just remember 320 and 319, you will be able to answer this particular type of question. Schedule 3 of MCI includes, there are 3 schedules in MCI, 1, 2, 3. One is all the degrees which are given by the universities which are recognized by MCI, the schedule 1. Okay. Schedule 2 is the degrees which are given by outside India, and schedule 3 has 2 parts, 1A and schedule 3A and schedule 3B. The first part is the degrees which are not included in schedule 1, the first part. The second part is the degrees which are not included in second schedule. Okay. Schedule 1 is the degrees which are given by the universities which are recognized by MCI. Schedule 2 is the degrees which are given by the outside India. Okay. Schedule 3 has 2 parts. The first part includes the degrees which are not included in schedule 1. The second part includes the degrees which are not included in schedule 2. Okay. So now the schedule 3 is MBBS degree of Indian University, it is schedule 1. Okay. So DNB degree is also schedule 1, and MBBS degrees of foreign universities is schedule 2. The diploma of CPS, it is a very age old diploma of some physicians and College of Physicians and Surgeons, which is in Bombay, like Royal College of Physicians. They have formed a College of Physicians and Surgeons, and that those degrees, they don't fall in schedule 1 or 2, they fall in the schedule 3 subpart A, which is the degrees which are not included in schedule 1. Section defining the rape, 375. 304B is dowry death, 302 is punishment for murder, 375 is definition of rape, 376 is punishment for rape. Punishment for perjury is covered under section. The first question almost. It is, what is 191? Definition of perjury. 197, we had a question on 197 also. False certificate. Doctor giving a false certificate. 195 is giving or fabricating a false evidence with intent to procure conviction. That is all not important, don't remember that. Okay? Don't remember 195. Okay? Grievous hurt is defined. 318 is it is regarding a child. Okay? A child till the age of 12 years should be protected. When there is abandonment of child less than 12 years, the parents are liable for punishment. That is 318. Okay? Don't remember 318 also. 319, 320, 321. You know all the 3. Okay? Which IPC includes vitriolage? Vitriolage is acid, throwing of acid. So is it 318, 319, 320? 318 is abetment of child. A child below 12 years is abandoned. 319 is simple injury, simple hurt. Okay? 320 is grievous hurt. 321 is voluntarily causing hurt. So it is grievous injury. Throwing of acid will cause damage. Disfigurement of face can be there. Dowry death is covered under which section? 304? B. 304A is rash and negligent. 498, cruelty. There is no death in 498A. 498A is only cruelty. The torture is there. The woman will go and say that the husband or the in-laws or the relatives of the husband are harassing her. Okay, she will be alive. 376 is punishment for rape. 375 is rape, 376 is punishment, 377 is unnatural offence. All are sexual offence sections. 319 deals with definition of hurt, voluntarily causing hurt, definition of grievous hurt, voluntary causing grievous hurt. Definition of hurt. Doctor who did surgery on wrong side of the patient is punishable under section 304A. 305A and 305, only 305 is there. Where is abetment of suicide in the case of a child? IPC which deals with dowry death, 304B. 319 definition of hurt, punishment, drowning.